What if you had a single resource that could change the way you treat women's health, covering everything from pelvic care to pregnancy, postpartum, and beyond? In this episode, I talk with authors Darla Cathcart and Rebecca Stephenson about their groundbreaking new textbook, The Physical Therapist Guide to Women's Pelvic, Prenatal, and Reproductive Health. This book blends evidence, compassion, and real world tools to support clinicians at every level. They reveal the behind the scene challenges, the surprising insights, and why this book is the guide that you've been searching for. Don't miss it. This conversation will leave you inspired to expand your practice in powerful ways. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this podcast episode. And boy, do I have a treat for you all today. I have with me Darla Cathcart and Rebecca Stephenson. And these two are both physical therapists. I'll let them introduce themselves in more detail, but they are the authors of this amazing resource for us as pelvic health therapists. It's the Physical Therapist Guide to Women's Pelvic, Perinatal, and Reproductive Health. And you guys, this book is a resource for us. It is incredible. And I am just super excited to be able to introduce you to the authors as we dive more into this book. So welcome, Darla and Rebecca. Thank you so much for being here.
Thank you.
So I would love, Darla, would you go ahead and just introduce yourself and let people know who you are, please?
Yeah, hi. Thanks, Lynn, for having us so much. My name is Darla Cathcart, and I'm a physical therapist for over 2 decades now. And I have practiced in private outpatient settings, hospital-based outpatient settings. I've owned a practice. I've been in academia in brick and mortar and hybrid programs, and I'm currently serving as the Director of Clinical Excellence and Education for Pelvic Health Solutions, which are some pelvic health and perinatal clinics based out of southeastern Florida right now.
Awesome. And Rebecca, give us a little intro of you, please.
Sure. Hi, Rebecca Stephenson, and I'm a physical therapist and medical writer. And I'm currently working at Newton Wellesley Hospital, part of the Mass General Brigham system in Newton, Mass, where I treat men and women of all genders. And I specialize in pelvic and obstetric care. I have advanced degrees and a specialization, as Darla does, as a women's health specialist.
Awesome. So you guys, these two, they've been doing it all. And we are so grateful for all of you and for both of you and for what you've done. And tell us and tell everybody listening in, what was the inspiration for this book? Why did you choose to write this book and what was the intention for this book?
So I can start off with that. And I had written 2 textbooks for physical therapists on this birth experience, women's health before, and I got inspired to do it one more time with very current literature review and references. And because of my long-term relationship with Darla and how we work and teach together, I knew she was the perfect person to co-author this with me. So we are equal authors, and we've met, took us 4 years to do this from start to finish, and we learned a lot. We think similarly and not similarly. So that adds for a very good textbook because we covered the range and we wanted to be very specific to work towards women and not to include men, not to be exclusive, but to be focused. And one of the things that I wanted to do was to take the experienced clinician as well that may be just be coming into this area, as well as the new clinician to this, to understand where did we originally come from? How are we in the United States even talking about women's health and how that influence happened? Both Darla and I are actively involved in volunteer positions for the Academy of Pelvic Health, which was started by Elizabeth Noble many years ago, who was influenced by the Europeans. So we start the book off with a history chapter, which I hope people find interesting. And Darla, let's have you talk about the intent.
Yeah, Darla, what was
Yeah.
your reaction when Rebecca asked you to join her on this project too?
It was, well, that sounds like a lot of work, but I was also excited about it. A little, I think I kept pushing it off, not because I wanted to do it, but because I knew once we got started that it was going to be a little bit behemoth, and it was. But I think from my perspective, the inspiration, the motivation was from years of teaching in the continuing education space, training people in pregnancy and postpartum courses and pelvic health courses, having students on clinicals, introducing pelvic and perinatal health in PT schools, that I really wanted to create something that could be very clinically useful being pulled off the shelf, that someone could take off the shelf as a newer grad, as a newer to pelvic perinatal health clinician, and that they could find this resource to be something that really supported them in their understanding and their ability to perform examination, differential diagnosis, treatment, progression of treatment. So we really wanted it to give just some really good solid guidelines, and not to replace really good educational courses or mentoring, but to be just a really nice foundation that can provide just some really clinical, useful tools.
Well, and being a therapist of 30 plus years, I found, looking at this and reviewing it going, oh, yeah, now I remember learning that way back when. But also the newer updates and the research that, should be guiding us moving forward. And I loved the whole section. You guys have a huge section on the breast and the breast tissue. And sorry, back in the day, that really wasn't covered in my training. So I really, really appreciated that in the book. But you guys go into the female pelvic health physical therapy examination and then treatment and the reproductive health. So breast disorders in that, high risk pregnancy, disease and disorders, care during labor, care during birth, postpartum care, and then the examination, evaluation, and treatment of musculoskeletal disorders during pregnancy and postpartum, and then developing a women's and pelvic health physical therapy practice. Like those are all the big chunks of your book. And then within that, you go into the nuances of each section. So you guys, it covers pretty much everything within the specific frame of women's health. And so, no, it doesn't cover all these other things, but you've got to stay focused because there was so much to cover just within this. You
Right,
guys,
right.
the amount
Yeah.
of research that you went through
Yeah,
to,
it's years and years of research. And I think, Lynn, you've captured it perfectly because we wanted to build on the female anatomical, physiological, and pathological considerations, and then looking at the female lifespan, and that's our foundational part. And then we're going into the pelvic health examination and treatment. And I'm glad you talked about the breast. It was one of my chapters, was that we wanted to talk about what can happen to the breast, whether it's a fibrocytic breast or maybe there's cancer, or in a later chapter we talk about blocked breast ducts that women experience in postpartum. And so a lot of times people don't even know the anatomy. And one of the uh, disheartening things is that people are not being trained to do breast self exams anymore. And of course, in very rural countries, that is incredibly important. But we've included both the clinician's examination of the breast as well as how you teach someone to do their own breast self-examination. So,
Wow. So critical because we all know we're the ones that get to spend the most time with them. And
right.
so I think that that is important that we bring this to our clientele, and actually not something that I really thought about until you just said it there, Rebecca. So that's huge. I mean, I deal with pregnancy postpartum, so I understand the clogged ducts and stuff, but wow, taking it that next step further and helping to make sure that our clients actually know how to examine themselves is really important.
Yeah, and we knew the limits of the book because if you start talking about breast cancer and treatment of breast, you're going to get into lymphedema. So it's not a textbook that teaches
Right.
you how to do lymphedema treatment or decongestive therapy. You would take other courses. So we're very I think specific in telling, that there are other courses that you're going to want to take. We do go into labor and birth positions, but you'd want to be taking a course that helped you through that. But this gives you a good basis before you go and take those courses.
Absolutely. And that's why I think this book needs to be in every practitioner's bookcase or shelf or on their desk even so that they have that reference and know that it's a reference for them to be able to use with their clients. And whether you're new or whether you've been doing this work for 30 years, I think everybody should have this book just to have that information as the baseline, and then we can go from there. Yeah. So
Yeah.
important. Darla, anything? What's your take on this book? What would you say your highlight of the book is?
Uh, I I feel like for me, and I have been teased about this in previous work groups that I've been in, but it is the organization that puts a lot of the content into very accessible kind of charts and bullet lists and call outs. And then a lot of the images that we put in, like sample bowel and bladder diary and the Bristol stool chart and pictures of examination techniques. I just feel like the layout creates kind of a nice linear process
Mhm.
for the therapist. And like you said, spells out all of what are all the basics and the things that we forget sometimes, right?
Yes. Yes.
And even I feel like when I teach a course or, writing a book like this, and you start kind of going through your references and pulling things together, there is that moment of like, oh yeah, I should be doing that, or oh, I forget about that, or oh, this is new and different. So it was such an enlightening experience just to refresh my mind around,
Mhm.
old things that I should know and do, and affirmation of things that I am doing, and then kind
Yeah.
of some new things that I was like, oh, I'm going to add that to my practice.
Right.
So one example is, in reading research around prolapse testing, for instance. We've always been taught to teach patients to instruct patients to, bear down as hard as you can. But then reading some of the biomechanical research around that, it's actually the amount of time that you ask someone to bear down that's more important than the amount of
Yeah.
force that you ask them to use. So asking them to hold for, 10-second bear down is really how you can elicit, visible prolapse or palpable prolapse. So that changed my practice actually to say, oh, I need to actually have somebody hold for a longer time. I'm less concerned about how hard they push. Anyway, so just kind of some of those
Yeah.
little nuances. And then I think too, just a lot of the step-by-step instruction that we included to just help make things really clear. Lots of
Well,
sample scripts too. Sorry.
no, no, no. I
I just
want
keep
to
throwing things out
thank
there.
you. I want to thank you for your mind and how it works linearly, because I love just going through some of those charts that you created. You have this issue, here's what you need to do, here's how you treat it. Here's like it just lays it out so beautifully. So thank you for that.
Thank you.
So
Yeah.
one of the things, whenever you write something and you put it down, I found this as a medical writer, is, it's going to change. But we had to include some things that sort of the timestamp of now. And one of Darla's chapters, she's gone over the ICD-10 and ICD-11 codes, which is very important. And, those are going to change. We know those are going to change.
Yeah.
We've given information in the appendixes on maybe other books to read and professional organizations, as well as the glossary, I think but I do love our charts. I really do. I think that helps. And one of the things that we had fun with is I had this idea before every chapter, let's put in a quotation that
Yes.
kind of will set the tone for that. And that was a lot of fun to find those.
Yeah.
And like on the postpartum one, I put in a quotation from Brooke Shields. Now,
Oh,
I thought she
yeah.
was the perfect person to. Um,
Can I read it?
yeah, sure. Go ahead. Give us
Okay,
the
so the
thing.
quote is, the very damaging, frightening part of postpartum is the lack of perspective and the lack of priority and understanding what is really important, by Brooke Shields.
And doesn't that do that for us? I
Yeah,
mean, don't
yeah,
we then get the chills and say, this is why I'm in this field, this is why I want to do this.
right.
And she was such a wonderful mouthpiece to bring postpartum to light. I mean, just working today with somebody who was 6 weeks postpartum, and the first thing I did was bring out the Edinburgh postnatal depression scale and was teaching somebody along the way.
Yeah.
I want to also sort of call out the two people who did our forewords. So one was Dr. Tracy Spitznagel, who's a professor at Wash U and has done a lot of international work, but we also had an international foreword written by Sonia Rejo Alicino, and she is a professor at the Faculty of Medicine and the University della Rulo, which actually Darla and I have both taught at in Chile, Santiago.
Oh, nice.
I think that this is universal and it sort of ties in with the beginning of the history chapter. How did we as a country, which is a very young country really in terms of the world, how did we get to this point where women's health is so important? And how can we then give back and inspire other countries, which, have asked for women's health education?
Yeah. That's great. Well, we want this book to be international, right? Because this can
Yeah,
be
sure.
anywhere in the world. Everybody can use this information. And I also want to just comment and highlight that you guys are both physical therapists, but even though this book is applicable to occupational therapy and occupational therapists that do pelvic health, because this is information that you'll want to know as well. And it's written just with a PT lens. So as occupational therapists read this, they're going to go, oh, and this is how I would approach it too.
Mhm.
And,
Yes.
having worked in this field and offering a little
Yep.
more holistic care to my clients, I'm like, oh, I bring that lens to what I'm reading in here. And I truly do believe that like this is a beautiful foundation for all of us to have as we address our clients, our clients as women. So was there
Absolutely.
any surprises? Anything that, kind of stood out for you both as you were writing this book? Darla,
Well,
go.
I can share. Yeah, I can share. I would say I wouldn't call it maybe it's a little bit of a surprise, but I had already written the pelvic examination chapter where we talk about pelvic floor muscle dysfunction and terminology. And after that chapter was completed and I had moved on to another chapter, the new ICS standardization around pelvic floor dysfunction terminology was introduced. So I was like, let me go read it and see if it's actually different. Maybe I can just throw on the new reference, but no, I had to actually go through and kind of rework that chapter a little bit, which was fine. But it was kind of a little bit of a rewrite. And then in writing that chapter too, again, I don't know if I'd call it a surprise, but just very interesting in writing about terminology around female sexual dysfunction. There were like 6 different references who each had their own, quote, standardized terminology. And it just highlighted for me why, getting, just really good reproducible research and understanding around diagnosis and treatment for our female, our cisgendered female patients that have sexual dysfunction, sexual pain. Like, no wonder it's so hard because nobody's even speaking the same language. The one group will call something, vaginismus, and another group will call it, the genitopelvic pain penetration disorder. And so you have these terms that people are disagreeing about, and there's even commentaries about disagreement about. And so that was just very interesting to me to be able to kind of lay, again, all of those out in the chart if you want to read all those definitions. But it was just very interesting to me at how much variation there is still out there when it comes to, standardized terminology in pelvic health.
Well, I think that's one of the challenges in research is that we're all calling things all different things, and that's really seen in the low back pain, pelvic girdle pain, posterior pelvic girdle pain, all those things, like
Yes.
no standardization. SIJ dysfunction for
Potato, is it the same? Is it different? What do we mean? Yeah.
I think one of the surprises for me was in doing the research on high-risk pregnancies, diseases, and disorders was the amount of disparity that we have across ethnicities in terms of maternal health in the United States. And so, the references for all of that is the CDC, which keeps our best references. It's a little different from state to state. So we tried to give it globally, but I think that for the practitioner that wants to get into the birthing space and feel safe, the chapter that deals with the high risk population, what are diseases that may have existed before she got pregnant, and what happens after, or how is the pregnancy affected by high blood pressure, that we got a lot of charts there and went through every single system. But I think we really have to be thinking about our sisters across the United States in terms of what is it that we can do in improving the disparities among underserved minority populations. And I think we have a really good chance of making a difference here in the United States.
Awesome.
Yeah. How can we help those folks be heard, empower them to be heard? I think is really important. And yeah, I feel like I even hear stories from patients that I have had that reading those, reading about those disparities, it was like, oh man, I've seen this in practice, and it's, I thought, well, maybe it's just my town, but to realize that it's not is, really kind of overwhelming at times.
Yeah, and birth is, as you know, Lynn, from the space that you're in, is so individual. And we need to hear women's stories. And one of the quotations that I've used in the physical therapy care during birth was from Elizabeth Noble. However much we know about birth in general, we know nothing about a particular birth. We must let it unfold with its own uniqueness. And I think that's what we do as practitioners is what is the uniqueness about this birth? How can we help her both during pregnancy and that long postpartum period? So,
we as PT and OTs in this pelvic health space really bring a unique perspective to supporting women in pregnancy and helping them to set themselves up for that smoother birth, faster recovery. That's my tagline. And I think that we have that biomechanical advantage that nobody else in the birth space brings to their support of women. And
Yeah.
so that's what we need to really be using our gifts, our skills to support these women. And like you said, throughout the lifespan, I mean, you guys even talk about high athletes and Red S and, all that. Like you guys cover so much in this book. It's incredible, you guys.
Yeah,
Anything,
we want people to not be fearful. And so if you
love
have
it.
education, then you won't have fear. Darla's got a great story about some of her students have read the book. Darla, share that, what they said about some of
Yeah.
different experiences of your students reading the book.
Yeah, it's not, and it's actually not my students. It's some of the newer therapists to our
Okay.
clinic.
Yeah.
And I've got one with 3 years of experience that came in, and I just sent the book to her a month before she got started, and I met with her, and she said, "I read it cover to cover," and I was like, "Bless you."
Wow.
But I
Wow.
was like, I don't know that I could sit down and read it cover to cover. I'm not gonna lie, no. But she said, it was just such a nice, easy read, and it was the way that it was laid out. She said it was just a really nice foundation. And my other two newer therapists, I met with one of them today, and she kind of said the same thing. Because she's waiting for her schedule to fill up with patients, and her comment was, one of the things I've been doing is just reading the book because it's just really helping me to kind of organize my brain. She's been to the first pelvic course, and she did a pelvic clinical, and she's got a little bit of experience. And she's like, it's just helping me just kind of go through all that again and really lay it out and kind of organize my mind around how I'm going to, approach these patients and think about these patients. So it was really nice to get that feedback
Yeah.
from those folks and to
Well,
hear that they're already enjoying the book. So
A couple of
great.
the physicians I work with, they've gotten the book and they're like, "Wow, this is incredible. This is really great." So,
Yeah.
and so the book can be for anyone in the birth space, could be for midwives, urogyns, gynecologists, uh, obstetricians, PTs, OTs.
Yeah.
So it's got a lot of applicability.
Yes, it does. And even from someone 30 plus years into the field, I find that it's super helpful to have because it helped me to remember some of the things that I had already learned that, are back in the recesses of your mind to bring them back to the forefront and go, oh yeah, I remember that. And oh, that's important to keep in mind. And so I truly do believe that this book should be in everybody's offices. Just and I didn't read it cover to cover yet, but I definitely found it helpful. And I see it somewhat as like an encyclopedia for us. When you got a client with this issue, let's look it up and let's see what you guys have to say about that. What does the research have to say about this situation? What's Darla's chart have to tell me on what to do? So,
Yeah, it
and
breaks things down so
it does.
you can understand it. And Darla is quite the educator, and so I think she helped us sort of formulate this for the different types of learner.
Yeah.
Maybe somebody's a visual learner, maybe they're going to want it by a chart, or maybe they're going to want it written out in a longhand. So and
Yeah.
I was very happy working with Rutledge that they actually let us have some colored pictures in there.
Yeah.
So with
we're excited.
female menstrual cycle and all the different applications of analgesia for labor and delivery. And,
Yeah.
in terms of being a medical writer, uh, we have to pay people in order to use and credit their work. And so it's just, I think, a very good compilation that's come together, and we're
Yeah.
very happy to have worked with Rutledge.
You know what? I
Yeah.
was just looking at it today, and I'm not sure which one of you put it, and I'm not going to be able to find it right now, but it was a beautiful little chart on the things that we should be going over with our pregnant clients. And it was during pregnancy, it was for labor, it was for postpartum. It was kind of like a plan. I think it was um,
The
I don't
birth plan?
I was going to
maybe
say
it
that
was
was probably
birth
Rebecca.
plan.
Yeah,
Yeah,
it's
that would
just
have
Yeah.
the
been
birth
Rebecca.
plan. Yeah.
Yeah.
Yeah, it was just
Yeah.
like had every little thing that we should have. And so like just taking that as practitioners and then creating a handout to give to our clients to have
Yep.
them go over and think about those things that is just so valuable in and of itself. So,
Yeah. So I was just working with a couple today. They're 4 weeks away from delivery. And I said, well, so are you going to take the childbirth classes? Oh, we're going to watch, we're going to watch some YouTube videos. So I showed them some YouTube videos of what happens in the pelvis just to start with, and what are the dynamics of that. And I said, there are all these different things. Do you want to have a scent in the room? Do you want to have music? Do you want to have a focal point? Here's some labor and birthing positions. Here's a plan that you could develop on yourself. Well, you could just see the wheels moving. And I think this is a passion for all of us, and
mhm,
it really is going to help the birthing couple, whatever the
yeah,
couple looks like. Um,
yeah.
so
Yeah, I love that. So you guys, please, listening to this podcast, please spread the word. Let other therapists know about this resource for us, the Physical Therapist Guide to Women's Pelvic, Perinatal, and Reproductive Health. It's phenomenal. So I highly recommend this book that you get it. It's a great foundation that we all should have, and then we can go from there. And like you said, it's no one book, no one course is going to have it all for you. And
right.
so we've got to continue to keep learning and exploring. And this, I think, is a resource that we all should have. So any last little tidbit, any last little information you want us to know? Darla,
Darla.
Oh, I'm like,
putting you on
Rebecca,
the
do you want to go
spot.
first? So I'm like, Darla, let's see. I'll say two
Rebecca, if you
things. I can say two things. One is, you were talking about how everyone should have the book, and I gave a copy to my parents that I, signed, and in our little acknowledgments, I'd acknowledge them. And when I brought it to them, my dad said, "I think I'm just going to let your mom have that." So I think my dad disagrees. He was a little frightened. He was like, "Are there pictures in there?" I was like, "Yeah,
Yeah.
Dad." He was
Oh,
like,
lots of pictures.
Lots of pictures.
he was like, "I think I'm going to let your mom handle that." So she appreciated it though. She
That's
appreciated
cute.
it. But the other thing that I'll say too is, I'm a firm believer that there's no one right way to do a lot of what we do. And so, this was written from our lens. And I think we really tried hard to keep things very kind of open and objective and to be really a guide and not this is how you have to do things, but here's a way that we recommend. And I hope that it comes across that way. Because someone may read some pieces and say, well, I do it differently. Is that wrong? And not necessarily, as long as you've
Right.
got good rationale and you've got, you know, reasons for how you do it and it works, then great, keep doing that, right? So
Yeah.
so
Yeah.
I just want to acknowledge too that I feel like it can be so easy in a conversation to be able to say that to someone of like, oh, well, this is how I do it and this is why, and to kind of acknowledge those differences, and to different though when you're reading print, it can feel a little sometimes rigid and cold, and I hope that our warmth comes through as much as possible, because we did write this book with a lot of warmth and a lot of care for the patients that we all serve, and just all the hard work and the heart I think that all clinicians put into this work. So I'm like actually tearing up just thinking about it, just thinking about all the amazing work that we all do in this field, and it's so important and valuable. So
Yeah.
yeah.
Well,
So
thank
here's actually what we did in our dedication to all the physical therapists and healthcare practitioners who improve the lives of women through their careful attention to clinically relevant findings, their scholarship, and selection of the very best treatment. May this book be the scaffold from which you can build your successful practice. We are so grateful for all of you and we admire you. So that is our heart and our love that we poured into here. And Lynn, I just can't thank you enough for supporting us and for being a megaphone for the book.
you. Yay. Thank you.
Yeah. And a megaphone for pelvic and perinatal health in
Yeah.
general.
Thank
Yeah,
you. Thank you
amazing. Yeah,
guys.
thank you so
Well,
much.
appreciate your time and coming on and sharing with us the amount of time and effort and energy that went into the book. You can feel it, Darla. You can feel it, Rebecca, the love that's in here. And so I just hope that everybody will be able to get it and use it and benefit from the work that you guys put into it. So thank you from the bottom of my heart for what you guys did and what you created here, because it's phenomenal. So thank you. Awesome. Thank you guys for listening into this podcast episode, and we hope that you will get this book and it'll be helpful for you in supporting your clients. So here is to smoother births, faster recoveries. Take care, everybody. Bye-bye.
Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.